And this is my disclosures. All the studies were conducted at Astellas, and all the authors are employees of the Astellas group. Next slide is about the research background of our study. Lysophosphatidic acid, LPR, is a bioactive phospholipid reported to contract the urethra or proliferate prostate cells. Last year, our group presented that the ASP6432, a novel antagonist for the type 1 LPR receptor, not only blocked the LPR-induced responses, but also potently decreased the urethral pressure in rats. However, the role of LPA or LPA1 receptor in the bladder function has not been studied, particularly in people. So in this study, we investigated the role of LPA and the LPA1 receptor antagonist ASP6432 on bladder functions in conscious rats using continuous cystometry. We investigated the effect of LPA and ASP6432, mainly focusing on micturition interval. In addition, we also evaluated the effect of ASP6432 on micturition frequency induced by the nitric oxide synthase inhibitor LNA. This is the result of our first study. Intravenous infusion of LPR significantly decreased the micturition interval, which was reversed by SP6432 in a dose-dependent manner. And neither LPR or SP6432 affected the maximal intravenous pressure, suggesting the primary site of action on bladder functions. In our second study, LNA also significantly decreased the micturition interval, which was also improved by SP632 in a dose-dependent manner. The last slide summarizes our results and conclusions. LPR induced micturition frequency, which was inhibited by the LPA1 receptor antagonist SP642. SP6432 improved the micturition frequency induced by LNM. Our results indicate for the first time that LPA is a substance modulating bladder function via LPA1 receptor. The result with SP6432 suggests the possible role of LPA1 receptor in bladder abnormality and the therapeutic potential for bladder dysfunction. Thank you for your attention.
Thank you. The paper is open for question. Well, I can start. No? Good, you start.
Chris Fry again from Bristol. Thank you very much. Did you notice whether the agent, the phosphatidic acid, altered frequency by changing the compliance during filling or altering the threshold pressure? Because it would tell you about the mechanism of action, wouldn't it?
Oh, okay. I didn't include the other detailed parameters. In our preliminary analysis, the compliance has not been changed significantly. The most pronounced change was observed in the decrease in therapeutic threshold pressure, right, suggesting it's affecting the sensory pathway.
Okay, thanks. Thank you.
Where is LPA1 expressed in the bladder?
Mm-hmm. We confirmed that LPA1 receptor is expressed both in smooth muscle layer and also urothelium. It's also still already a result from Western blot analysis. So in future, in situ, detailed analysis would be needed.
One of the key problems in the lysosphingolipid field has been generating selectivity for specific subtypes within the family. Mm-hmm. Can you tell us about selectivity versus the S1P and versus the other LPA receptors?
Mm-hmm. Thank you for the question. We have confirmed good selectivity for this compound over other LPA receptor subtypes and S1P receptor subtypes, and in addition, other major over 50 molecules.
More questions? Well, you speculate in your concluding message in the abstract that it could be associated, have a therapeutic potential in the treatment of BPH and overactive bladder. And actually the basis of this should be that it affects the nitric oxide system. And of course we know, at least we think we know that if you have a lack of nitric oxide in the bladder or in the urethra, you have a tendency to develop an overactive bladder or overactivity. But what is, well, is this enough, you think, for the drug to have a therapeutic potential? Because if you give a nitric oxide agonist, you don't affect very much of bladder function.
Well, this is only a part of disease, effect from a disease model, so it's still not enough to fully validate the therapeutic potential for bladder or urethral dysfunctions. And regarding the differentiation from NO-related compounds, our functional study result indicates that LPA pathway and nitric oxide pathways are different, are separated because of this is a different study, but the pattern of urethral relaxation is different between LPA1 antagonist and the nitric oxide pathway. So regarding that point, future study is really needed to fully understand the molecular pathway about our molecular selectivity of these two pathways. But so far, our consideration is that these are different independent pathways.
Okay.
And in prostate cancer, it's been implicated with epidermal growth factor, correct? Did you look at that with the results that you?
Yeah. I saw some papers trying to correlate the relationship between LPA and prostate cancer. So to some extent, LPA pathways implicated in the proliferation process of prostate cancer.
Thank you.